7 on the clock, Viveka और निकिता आपके साथ बहुत सारे WhatsApp messages. We'll read all of them, but we have Dr. Hesham Al Khateeb with us, consultant orthopedic surgeon, Emirates Specialty Hospital, and we want to know him. Want to know more from him about keeping our knees and our health in optimum condition. Good morning, Dr. Hesham.
Good
Morning.
morning.
Hi.
Good morning, doctor. So, with the
Good
summers
morning.
and the heat, coming up, the causes of knee pain, if you can just explain to us how we can take care of our knees to get rid of
For,
pains, because a lot of people are suffering, doctor.
absolutely. Well, thank you very much for having me, and I hope you're all having a great morning. So, knee pain can obviously be caused by a number of things. Now, the way I look at knee pain, because obviously being a knee specialist, that's what I tend to see on a regular basis. It depends on your age. Now, if I see patients of all ages, but if you're on the fairly younger side of things, so if you're in your 20s and 30s and maybe early 40s, it's usually sports related. So you may have had some injury while you're at the gym, you may have twisted your knee, and in that case, it could be due to a cartilage tear, what we call as a meniscal tear, or it could be related to a sprain or a ligament injury. Now, as you grow a little bit older, as we all tend to, now if you're in your 50s and 60s, the causes of knee pain tend to be because of what we call as degenerative conditions. So that usually is a little bit of arthritis, a little bit of wear and tear. Now, the treatment depends obviously on the diagnosis, and that's what I tell all my patients. The first step in treating knee pain is trying to find out the cause. Now, when you come to me or you come to a knee specialist, the key thing probably we need to do is we start off by getting some x-rays, and in most cases we get something called an MRI. Now, that will be able to diagnose the problem effectively. In most cases of knee pain, all you may need is maybe a little bit of physiotherapy, a little bit of exercise, and that usually works. Now, if you have a tear in the cartilage, we can do something called an arthroscopy, which is a keyhole procedure, and it takes me about 10 to 15 minutes, and you go home the same day, and you're back at work the next day. There's zero downtime. If it's as you grow older, when you're dealing with arthritis, there are lots of treatment options. We can do injections, we can do some physiotherapy, and in sort of severe cases, we can give you a brand new knee, is what we call a knee replacement.
So, doctor, what measures can we take to prevent knee pains during summer? Because I believe dry heat also contributes to some extent for
For
the
sure.
knee joint pains.
For sure. So the key thing is trying to be as active as possible. Now, I have a lot of patients who've started taking up new sports, particularly in the summer. The weather is getting obviously a little bit warmer. So they've started taking up paddle or tennis or swimming. And in some cases, they haven't really had any previous experience with exercise. So I tell them stretching is crucial. In fact, it's essential. So I think before you start any kind of exercise, it's worth spending 10 to 15 minutes of stretching, a little bit of warming up, what we call as limbering. So your body heats up and you stretch those ligaments. And the older we get, the more time we need to really focus on stretching those ligaments, stretching those tendons, trying to spend a little bit of extra time warming up before you start the activity, and that's crucial. The next thing is staying hydrated. I mean, it's very easy in this part of the world to maybe not drink enough, and as you know, joints, they just need to be lubricated, just like anything else in the body. And as you grow older as well, there's a chance that you may not be as lubricated, your joints may not be as lubricated as we'd like them to. So I think drinking enough fluids, trying to stay healthy, eating certain products that can help with protecting the joints, things that are rich in magnesium, zinc, and vitamins, those are crucial. And all these little things will make a huge difference on the long term.
Are there any therapies that you can recommend, Dr. Hisham? Because there are lots in the market, for example, the cold therapy, the heat therapy. Is there something that we could look into in today's day and age?
Yeah, I think I get asked that question a lot, whether putting a cold pack or a hot pack, what's better? Is it cold? Is it the heat? Now, it's important to understand the principles behind each one. So a lot of us watch sports or maybe get involved in a lot of sporting activities. So if you're watching particularly football, you see when one of the football players has an injury, they rush and they put an ice pack on his leg or his knee or the injured part. And the reason for that is what cold does. It causes something called a vasoconstriction. So it restricts the blood supply and that reduces the swelling. So cold works beautifully well in an acute sort of incident. Now, if you've got a chronic injury or if you've got long-standing problems with the joint, applying cold compresses isn't really going to change very much because all it does is just constricts the blood supply. What you really want is heat. So heat works if it's something that's been there, it's a recurring problem, something that's been happening regularly. And what the heat does, it actually does the opposite of what the cold compressors do. So they actually open up the blood supply and allows the blood to go into the injured area, and that blood will bring in all the good stuff, all the vitamins, all the minerals, all the healing properties that we need to get into the joint. So if you've had an acute injury, I think in summary, you can apply some cold compresses. If this is an ongoing problem or something that's been happening for quite some time, I think heat packs work beautifully well.
Doctor, can emphasize on the importance of vitamin D taking the sun, because we are in the summers now, but a lot of
Yeah.
people do have the deficiency of vitamin D. Does that also contribute to the knee pains?
100%. So vitamin D is surprising, even though we live in the Middle East and particularly in Dubai. I think the number of patients that I see who have vitamin D deficiency is actually quite remarkable. And part of the reason is because we actually tend to cover ourselves because we don't only expose ourselves to the heat. But that has obviously the disadvantage of leading to vitamin D deficiency. I think it's important to at least check your vitamin D levels as a base point, and then based on the severity of the condition. So if you've got severe vitamin D deficiency, taking some vitamin D tablets is actually fantastic. Now, whether it's causing the knee pain on its own, I'm not too sure if vitamin D in isolation will cause knee pain, but it does cause generalized joint pain. It does cause generalized fatigue. It does cause some weakness. So vitamin D is important, as a vitamin to maintain our overall, health. But particularly in joints, when it comes to pain, when it comes to stiffness, vitamin D is very important. So I think getting the appropriate exposure to sun. But I think if you got any sort of doubt as to your vitamin D levels, I think there's no harm checking it out.
Dr. Hisham, my last question to you for the day would be about, people with preconditions with knee pains and joint pains. Is there anything that you, recommend as an annual checkup with the orthopedics, or, going back to the doctor for a checkup annually?
Yeah, I think it's important, particularly if you're a lot of patients now are doing a lot of sporting activities. We're all very active. If you look at the lifestyle that we have at the moment, there's a lot of people doing a lot more in terms of maybe even if it's just walking for half an hour, going to the gym, doing a little bit of treadmill, doing 10,000 steps a day, doing a little bit of Pilates, a little bit of yoga. So I think if you are doing some kind of activity, I think at least an annual checkup is an excellent idea. It doesn't have to involve any procedures. Just even getting a simple X-ray, checking your vitamin levels, checking your overall bone health, I think on an annual basis is excellent. And like I said, there are lots of things that we can do to protect your joints, including plasma injections. There's a lot of organic, natural things that we can do to protect the joints, whether it's PRP or we even inject hyaluronic acid. Those are fantastic for knee joints, and they actually protect the knees, for years and years. And that's only a once-a-year injection, and they do beautifully well. So I think once-a-year checkup is actually an excellent idea, particularly if you're getting involved in a lot of activities.
Thank you, Dr. Hisham. Wonderful speaking to you, and thank you for breaking
Pleasure.
us down in terms of taking care of our knees.
Pleasure. Have a great day.
You
Speak
too,
to you
doctor.
soon.
Have a good day.
Have a good day. Bye.
Bye.